The first stage of syphilis is known as primary syphilis. It typically begins with the appearance of a chancre. This is the sore that marks the spot where the bacteria entered the body. A chancre usually develops about 3 weeks after exposure to the bacteria. However, this time frame can range from 10 to 90 days. Many people might not notice this initial sore, especially if it is in a hidden location. The chancre itself has specific characteristics. It is usually firm, round, and small. A key feature is that it is often painless. Because it doesn't hurt, it can easily be overlooked or mistaken for a minor pimple, ingrown hair, or a small cut. While there is typically only one chancre, some individuals may develop multiple sores. These sores are highly infectious. Any direct contact with the fluid from the chancre can transmit the bacteria to another person. The location of the chancre depends entirely on where the syphilis bacteria entered the body. Common sites include the penis, vulva, or vagina. Secondary syphilis marks the stage where the infection begins to spread throughout the body. This stage usually starts as the primary chancre is healing or several weeks after it has disappeared. The hallmark of secondary syphilis is a skin rash. This rash can appear on one or more areas of the body. It typically does not itch, which is a distinguishing feature from many other types of rashes. The rash can vary in appearance. It might look like rough red or reddish-brown spots. A characteristic feature of the secondary syphilis rash is its appearance on the palms of the hands and the soles of the feet. Besides the skin rash, other symptoms may also develop during this stage. These can include fever, swollen lymph glands throughout the body, and a persistent sore throat. Some individuals might experience patchy hair loss, particularly on the scalp, eyebrows, or beard. Headaches, unexplained weight loss, muscle aches, and general fatigue are also common complaints. Section 5. The silent threat and severe outcomes, latent and tertiary syphilis. Following the resolution of secondary stage symptoms, syphilis enters the latent stage. Latent means hidden. During this period, there are no visible signs or symptoms of the infection. An individual in the latent stage will feel perfectly healthy. However, the bacteria are still present in their body. This stage can last for a very long time, sometimes for many years or even decades. Without treatment, a person can remain in the latent stage indefinitely, or they may progress to the most severe stage of the disease, which is tertiary syphilis. The latent stage is often divided into 2 categories: early latent and late latent syphilis. Early latent syphilis is generally considered to be within the first year after infection. During this period, infectious lesions from the secondary stage can sometimes recur, meaning the person can still transmit the infection. Late latent syphilis occurs more than a year after the initial infection, or when the timing of infection is unknown. In late latent syphilis, the person is usually not considered infectious through skin contact, but the bacteria continue to pose a long-term threat to their own health. Pregnant women in any latent stage can still transmit syphilis to their unborn child. If syphilis remains untreated, a certain percentage of infected individuals, roughly 15 to 40%, will eventually progress to tertiary syphilis.